Hello, my name is Jessica Ahrens, and I work in the Rehab Psych Lab at the Lawson Health Research Institute as a research assistant. And today I'll be talking about a systematic review and meta-analysis that we recently conducted called Cognitive Behavioral Therapy for Managing Depressive and Anxiety Symptoms After Stroke. So post-stroke anxiety and depression are very common and disabling conditions that can often result in impaired recovery for stroke patients. For managing general anxiety and depression, CBT has been demonstrated as an effective tool. However, research still needs to be conducted to determine if it's effective in managing these psychological symptoms specifically for stroke patients that are living in the community. And therefore, our objective with this systematic review and meta-analysis was to evaluate the efficacy of CBT on anxiety and depression among the stroke population. So to do this, a literature search was conducted to locate studies published from Medline, PsycInfo and Cochrane between 1990 and May of 2020. Keywords used included stroke, mental health, and cognitive behavioral therapy. And studies were included if primary trials involved CBT-based intervention that targeted anxiety and/or depression, if participants experienced a stroke at least 3 months previous, and if participants were at least 18 years of age. So with these criteria, we found only 10 articles of our 563 original records. So 6 of these 10 articles were randomized controlled trials and 4 were pre-post design. So within these articles, cognitive behavioral therapy interventions showed large effects on reducing overall anxiety and depression symptoms at the end of the CBT intervention. So you can see that with our effect sizes of above 0.8, which is what we interpreted as large. And for our 3-month follow-ups, so this is where participants conducted questionnaires, and they found that there was moderate effects at reducing anxiety and depression symptoms. And this is seen as effect sizes are larger than 0.5, but still below 0.8. Further, a sub-analysis found that group-based interventions had similar effect size as individual-based CBT interventions. This demonstrates the potential for increased access and cost savings through the use of these group-based programs. Additionally, our analysis found that a relatively brief 8-week intervention may be more effective than long-term programs. And therefore, this meta-analysis provides evidence that CBT interventions are efficient in managing post-stroke anxiety and depression, as well as identifies factors that should be considered for healthcare providers within the stroke population. And this is where you can find our lab, and feel free to ask us any questions you may have. Thank you so much.